Hi, it's Dr. Sahar Roked here, and I'm going to do a quick video about women's cycles. Now, this might seem a bit of a weird thing to talk about, but I have found there's an increasing amount of women who are having a menstrual cycle and a period who don't know what's going on in the cycle. You're not really taught it in school and you don't know really. And I've spoken to several people who've been trying to conceive, fall pregnant, and they haven't known when they're ovulating and when they should be trying. And yes, someone very close to me was like, oh, I'm not falling pregnant. And when we got to the nitty gritty, I'm like, well, you're doing it at the wrong time, so you're not going to get pregnant. So these are really important things to know, that if it's not relevant for you now, maybe we should be telling, daughters and other people so they understand what's going on with the cycle. So basically, day 1 is the first day of your period, the first day you bleed. People are often confused because they think day 1 is the day your period finishes. But in terms of for tracking, we have to call day 1 the first day we bleed. And if it's a little bit of spotting, we could maybe extend it to the first day of proper bleeding. But if you're one of those people who spots for quite a long time, we have to count that as day 1. So day 1 is the first day you bleed. And most women bleed for between 5 to 7 days. Some go a little bit longer. Anything more than about 10 days, you probably, it's a bit of a hormone imbalance there. So maybe you want to come see someone like me or, somebody else who can help you with that. So that's the first week, basically, of your cycle. And then you ovulate normally around days 10 to 14, more around day 12. Now, this is how you know you ovulate. Some women get a pain in one of their sides where the egg's being released from the ovary, and that is called Meckelschmerz. I remember I used to have it in my 20s and I had no idea what it was until I learnt about it through my work, and I'm like, that's why I get that funny pain. I know what it is now. It can be like a really bad stitch. For some women it's just a bit of pain. For some women like myself, you sometimes need to take a couple of paracetamol and that should be enough to pass it on. But there are other things you can look for. You might feel hotter because you have high estrogen. You also might feel hotter, as in more sexy, because the high estrogen gives you a bit of a bounce and the spring in your step. So you might notice you glowing a bit more, men are looking at you on the street and giving you the eye and things. So that's always a good thing, right? You would also normally notice a change in your vaginal discharge. So they describe it as an egg white discharge. It's slightly thicker and a bit whiter. Well, like egg white, basically. That is the best way to describe it. Now, biologically, the reason you have that discharge is because it's a bit sticky and it's meant to trap the sperm so that you can fall pregnant easily. So yeah, Mother Nature has her ways, right? And then you get the bit of the pain because you're ovulating. Now, if you're trying to get pregnant, you might want to do the ovulation sticks and things like that for a couple of months. But if you now know what you're looking for and you know the days you're looking for it on, that can help correlate the cycle. Some women do ovulate a bit earlier or a bit later, and that's very helpful to know, because then again, if you're trying to get pregnant, you can time your lovemaking around that, basically, to try and conceive better. Now, in the second half of your cycle, the estrogen starts dropping off and then the progesterone kicks in. So normally on the 3rd week of your cycle, you can feel quite good. Maybe not as bouncy and as sexy as you did when you were ovulating, but you should still have good energy, feel well, be able to do things in the gym, feel quite social. So that's a good thing. And then your progesterone, if you're not pregnant, can drop in that 4th week. And that's what lots of women come to see me about in clinic, because their progesterone's dropping and their PMS, premenstrual syndrome, is bad. So not just like a day of feeling more emotional when you're watching EastEnders, but really feeling quite low, no energy, can't get out of bed, bloated, skin's not good. So that's why a lot of people come to see me. And if we use hormones in a woman who's menstruating, it is normally at certain times of the cycle, which is why it's really important to know when those times are, so we can just get really in tune. You can get in tune. I have a women's cycle tracker, which is also very useful to maybe track these things: energy, mood, sleep, skin, over a few months, and then you'll get a bit more in tune with what's going on in your cycle. I normally say to do it for about 3 months, because that is more consistent than just doing it for 1 month, that you can see more patterns. So I hope that helps explain the menstrual cycle to you. And if there's anything else you want me to do a video on, do let me know. Bye.